Welcome to our 11th Force for the Future event. Thank you so much for joining us. I'm Kathy Dom Clement, Chair of the Family Place Board, here with Nancy Bloomfield, our Executive Director. Before we start, 2 Zoom housekeeping details to share. All attendees' cameras and microphones are turned off. The chat feature is also turned off. Our moderator will share information about how you can ask questions during the presentation and what to do if you need technical assistance. The Family Place works with very young children and their families, the building blocks of our community. The COVID-19 pandemic challenges that foundation in many ways, including children's mental health and early development. It also illuminates the vulnerability of our childcare and education systems. Thankfully, today's speakers won't leave us in the place of challenges and vulnerabilities. They'll speak about opportunities for professionals, individuals, and communities to work together to repair, restore, and re-envision the road forward for our children and their families. I'm pleased to first recognize our sponsors and then to introduce our moderator. A heartfelt thank you to our sponsors. The Aloha Foundation, inspiring all people of all ages to learn, explore, grow, and be their best self. To McSorley McCoy Company, accountants and business advisors, Sheehy, Furlong, and Beam attorneys, Snyder, Cahoon and Company accountants, Vitt and Associates attorneys. I would also like to thank the Family Place staff, board, and strategic advisors for your enduring commitment to the families of this community. Now I'd like to introduce Charlie Whelan, who will be moderating today's discussion. Charlie is a lecturer and policy fellow at the Rockefeller Center at Dartmouth College, a former Family Place board member, current strategic advisor, and all-around terrific supporter of the Family Place. Thank you, Charlie.
Thank you, Kathy. I'm sorry we can't all be in person, but of course the challenge of COVID is what we're going to be talking about. It's affected everybody in some way. Hopefully we see a path to the post-COVID future, and that's what we're going to talk about. Let me introduce our panelists, and then we'll come back and start the discussion. For all of you watching, you can send questions at any time by entering them in the Q&A function. Our Family Place staffers will review those questions, push to the top the ones that are being asked frequently, and so on. And if you have technical challenges, you can put that in the Q&A function, not chat function, as well. So here are the folks we are very lucky to have with us. They have different views on the whole elephant that is facing us, complementary positions, and I think we're going to have a great discussion. Tanya McMurray is the clinical director at the Family Place. Rick Dustin Eichler is the principal at the Dothan Brook Elementary School. Amber Houston is an early intervention specialist at the Family Place. And Rebecca Holcomb is a former Secretary of Education for the state of Vermont, as well as having done many other things in the field of education. So let me start, although we're going to be talking about COVID, by level setting where we were before COVID came along, because we were facing a lot of challenges then, and I don't think we want to neglect that. So Tanya, if you could talk a little bit about some of the most significant social challenges that were facing children and families before we got the coronavirus.
Sure. I think even before COVID, we had seen a pretty steady increase in mental health issues with children over really the decade before COVID hit. By 2019, 1 in 5 children had a mental health diagnosis. So that's 20% of our kids who walked into COVID already struggling in some way. We had been dealing for quite a while with the opioid epidemic, which impacts children and families hugely. Children who are growing up in homes with parents who are struggling with substance misuse have a home life that is pretty chaotic at times and not very predictable. And parents sometimes when they're struggling with substance misuse are not able to provide the care they need to provide. Also, unfortunately, it results often in children ending up in state's custody. And while there certainly are times that children need to be removed from homes because it's not safe, it's almost impossible to remove a child from their parents without causing some kind of damage and trauma in that process. I think the other piece I would add is one of the factors in the decade before COVID is really the rise of social media and its impact in our society at large, but particularly for kids. And certainly, you know, we think about, I think, teenagers and preteens using social media a lot, but even younger kids more and more are getting onto, you know, Xbox or whatever gaming platform they're using, and they're, you know, on Roblox, or they're playing Minecraft, or they're playing Animal Crossing, and they're either on a headset talking to people, or they're using a chat function on that game. And so that's connecting them to a much wider world, which is a topic for an entirely different panel discussion. But I think the part that plays in here for kids is that really impacts social emotional development, because it really starts to impact the way we interact with other people. I know I have a 17-year-old daughter who a couple of weeks ago, we were both sitting at home in the living room. She texted me, right? And I'm saying, wait a minute, you know, we are in the same room. We could actually like have a conversation where we make eye contact and read body language, and, you know, but I think that is, you know, part of what happens with kids. And then I think that those changes in the ways that we have social interactions certainly change the ways kids interact with each other in schools. It has a huge impact on bullying in schools and what bullying looks like now compared to when some of us were younger without cell phones, and when you had to bully someone in person, and, you know, that tended to tamper a little bit with the mean things that might come out of your mouth. And it's so easy to send something, you know, and kids are impulsive. So when they're mad and they text something, they don't really think about what is the end result, and that plays.
And it can reach 200 people at once, and you know, or 2,000.
Absolutely, because they're on these huge chats. So
Rick, I see you nodding a lot, and you are, of course, running the building where all of these social emotional challenges come to roost. So is what Tanya described consistent with your experience pre-COVID? And how does that affect your ability to create a building where people are thriving academically?
Yeah, thank you, Charlie, and thank you, Tanya, for setting the stage so well. Yeah, as we look back to what schooling looked like pre-COVID, you know, one of the pieces that where my mind initially went to was the introduction of the Common Core standards. You know, back in the early, 2010, 2012, we started looking at those standards and then bringing them into our school. And what we saw with those standards was that they were really high. And, you know, high standards are great. We want our kids to be learning at the highest possible levels. But as we started to get to know the standards better, and as I started talking to, local pediatricians and local mental health people, we all seemed to settle on that, especially at the early ages, that the standards were too high. Requiring a kid to be on grade level at kindergarten to be reading is too much. It's not that some kindergarteners shouldn't be reading, not that we shouldn't be giving kindergarteners, first graders opportunities to be being their best selves. But when we are saying that if you are not reading by the end of kindergarten, that you're behind, that's not developmentally appropriate. And what we've seen from that, along with everything that Tanya said, I checked off everything that I had on my notes, right? We saw a real increase in anxiety amongst students. And, we have tried at Dothan-Brook to really remain connected to a developmentally appropriate play-based education, especially pre-K, kindergarten, first grade. And that gets harder when the standards are so high and there's pressures to be pushing those kids along in ways that's just not appropriate. And so for me, it's those combinations. But what we had pre-COVID was much stronger relationships with families. They were coming into the schools every day, dropping off their kids. They were walking down to the classrooms. We had open houses, movie nights where families got together, ice cream socials, all those great things. And when COVID hit, we lost a lot of those connections. It became a lot harder, and a lot of that split along certain lines for families who didn't have access to great technology or high-speed internet, or the skills and the comfort to be contacting people, educators, teachers over this medium. So that became a real large challenge.
Amber, when COVID hit and severed abruptly the kinds of social connections that Rick was just describing, how did that affect the nature of the challenges that you were facing working with children and families?
Yeah, so thank you, Charlie and Rick and Tanya. I think, you know, just as Rick has said, it just had such a huge impact. So really what we do in early intervention is support families to support their children's development. And a lot of families were in these situations where they needed so much more support because those natural systems that they had in place, friends, family, neighbors, people that would have normally been there are suddenly not. And also they're not going into schools, they're not going into play groups, they're not able to access a lot of the community programs and services in the same way. And because of that, we have families who are just feel really isolated and really on their own. And I think, if I may give an example, I have a family, you know, that I'm thinking of where there are 3 children in the family, and COVID happens and they find disruption to employment, to education for the older children, their access to us in early intervention. That then brings about this situation where they don't have the support in place. Historical issues with domestic violence and mental health challenges bubble to the surface. And so we as early interventionists, before we can even get to the really important work of development, we need to help that family be supported again. So that looks like connecting them with programs around employment subsidy, housing subsidy, connecting them to food delivery, diaper banks, helping to make sure that they had a stable internet connection so that they could engage in homeschooling, engage in our services. And through doing that, we were then able to support development. We were able to work to their strengths, help that family with strategies that meant they could give their child that support they needed. But it's really about making those connections. We just saw families in isolation in really difficult situations when COVID happened.
I suspect we could have similar conversations in every community around the country right now, both about the challenges before COVID and then the COVID challenges, in part because these are social and systemic challenges. So Rebecca, do you want to address the larger picture here about how society has gotten to a place where we're wrestling with these issues that we are?
Right. Well, since Rick brought up the Common Core, I just have to point out that we did invite legislators and journalists to take the Common Core assessments when we rolled them out in Vermont. And I could only get 3 to sign up to take it, and 1 dropped out halfway through as soon as they hit the math portion. So I don't think it's your students alone that are going to have trouble hitting what we call grade level on that. But first of all, I am just so privileged to be in the context of, or on this panel with the panelists here today, because to me, the family place embodies the way forward for us, which is we need to be thinking about 2-generation solutions that are focused on helping parents so that the parents can help their children. And to me, that is where Vermont is falling down right now. It is, and part of that is that we haven't adequately funded many of these supports, but we also haven't thought about how to make sure that people have real access. And when we talk about public school, for example, everyone knows that they can go to public school. Not everyone knows that they can get mental health. And many healthcare plans, even for people who have good jobs with healthcare, don't consider mental health healthcare. And we all know that terrible things can happen to anybody. And the reason we have safety nets is so that when that terrible thing happens to your family, there is some support for you so that you can go on and grow up, thrive, and be healthy. And that's what we're seeing now. As Amber, you said so powerfully, what happened when COVID hit is the relationships that sustained and supported so many members of our communities were pulled away, and we were left to the safety support systems that exist. And what we found in many cases is that they're actually not there. I want to pick one example that relates to Rick, because I think it really explains part of the problem in the thinking we've had. The state has been systematically underfunding mental health supports for adults. The cost of that is falling back into school systems, which are the last safety net for kids. But you can't use school dollars to take care of parents right now. So Rick can provide those kids with all the love and support they need in school. And if they go home and the family still has not been supported, his staff has to start over all again tomorrow. And the same thing happens at the family place. So the problem we have is that we are not investing upstream in keeping people healthy from the start. We're waiting until after they are really struggling. And because they don't have those relationships, many of them are left without any of the support that they need. And even people who love their children and spend every minute of their day trying to figure out how to keep their family together, they just don't have the networks and the services they need to do what each of us wants to do most for our kids. And that's where I hope we can turn as we come out of COVID, because until we rebuild those safety nets and think about how to put families first so families can take care of their kids, to make it so that services aren't conditional on you having enough time and systems know-how to figure out how to find someone who will actually take you for the not very big voucher that you might be given from the state that doesn't really cover the cost of care. We haven't thought through those systemic issues, and that's what we need to turn to next.
Certainly, one of the things we've learned during COVID is that different families were affected differently. Can you each talk about a lesson? So in my world, we know, for example, that in general, high-income families did better with online schooling than families that were more stressed and had fewer resources. We're thinking that the losses from the kids who are out of school for over a year are going to be quite profound. So if you could each talk in your relative space, and maybe we'll go in reverse order here, talk with Amber about what you noticed about who was able to thrive, who suffered most once COVID caused its disruptions.
Yes, thank you, Charlie. And I think it's difficult to kind of peg the who had it worst to who had it best, but I think there are definitely some groups that we were able to see who were struggling in different ways. So when I think about first-time parents during COVID-19, I mean, the world of being thrown into parenting is a challenging one in and of itself, but to not have those support systems in place, to have nobody be able to visit your child, maybe for the first year of its life, to not have play groups and support groups, and even just a cup of coffee with the neighbor who you can say, I haven't slept in days. That's a really big deal. And we were seeing lots of families who just didn't have that support, and they didn't even know what that support would have done because it was their first time being parents. And that is sort of a different challenge to deal with versus, say, a family who had a really medically complex child that we were working with, and their worries were around, how do I keep my child safe? You know, they need all of these medical services, these appointments, these therapists coming in, but every time we encounter someone, we are exposing ourselves even greater to COVID-19. And what does that feel like? Again, without all those support systems in place. And then, you know, just thinking about the family that I spoke about earlier, that some long-standing challenges in the family, you add the increased stress and strain of COVID-19 and what that bubbles up. So, you know, I think it's hard for me to say who was worse or best off, but I think each family in each different situation was dealing with challenges in different ways. And therefore, it's difficult to know always exactly how to help. You really need to get in, understand that family, understand the challenges, so then you can understand how do we support them to then support the development of their child and their health and well-being.
So Amber used the word patterns, which I think is a nice way of describing this. So Rick, are there patterns that you observed in terms of how different families were affected by the pandemic?
Yeah, so I want to answer that by going back and talking a little bit on something Rebecca touched on in her talk. So what we've seen, we started to see this pre-COVID, and COVID really highlighted it, that schools are becoming providers of last resort in our communities. You know, kids show up at school nearly every day. Families count on us being there. And so we are in a place where we have to address kids' needs, because we know if kids don't have their basic needs met, you know, think low on Maslow's hierarchy, they're not going to be able to access their education, right? So one thing that I'm really proud of the Hartford community is that, you know, we have invested really a lot of resources in supporting kids' mental health well-being. You know, we've developed partnerships with our local designated agency, HCRS, but because of workforce shortages, there's just not enough mental health supports around. So for example, and these are rough numbers, so forgive me. You know, this year at the Dothan-Brook School, we're spending about $500,000 on mental health supports for our kids. right? That's money that's coming out of the school budget. That's money that we don't have to invest in academic supports for our kids. So if we think about this as an equity issue, right? Communities who don't have the same need, communities that are schools that work in communities that are fortunate to have well-staffed mental health designated agencies, they don't have to spend that money. So they're able to invest more fully in child's academic education. So around the state, one of my hypotheses is that we're going to see some really growing inequities over the next years as far as academic access because of this change in resources. One other thing I just want to give a quick shout out, one place that I've really appreciated in the post-COVID world is our local rec departments, right? I know I was fortunate if my kids went through when they could still access early childhood rec programs. They could be out on the soccer fields doing Smart Start and all of that and running around like crazies and learning how to control their bodies. A lot of kids during COVID didn't get to experience that. So I remember our first day for kindergarten recess. Last year we were in pods, so kids didn't, they were only interacting with about 12 other kids throughout the day. And so this year we had all the kids on the playground, and it was mayhem that first day because they'd never had that experience being on the soccer field, playing baseball, playing basketball, and learning how to control their bodies. So we really had to slow down and reteach those things just because those important rec programs just didn't happen as much over the COVID year. So it was an interesting, for me, it was an interesting side effect, a really crucial one, right? Because we don't want kids slamming into each other and having bad experiences, but like really highlighted that partnership in ways that I haven't thought of in the past. So
yeah, a playground is a very socially complex ecosystem.
yeah.
Tanya, what did we learn at the family place about serving families during COVID? Perhaps some lessons that might carry forward.
Well, I think Amber said it well, right? That there's no one solution for everybody, and that different families have different needs. So certainly, there were families who telehealth worked really well for. In fact, I have families that I'm not sure I will ever see in person again because telehealth works really well. There are other families it didn't work for at all, either because they didn't have a connection or because that's just not the way that they communicate. And so I think learning how to meet people's needs in really challenging times and being able to understand what's going on in a family, what are the particular stresses that those families have, and what are, I think Amber spoke really well about that idea that you can't just walk in and say, we're going to focus on your child's development when I don't know how we're going to eat tonight. Because I can't really talk to you about my child's development if I don't know how we're going to eat. And I can't talk to you about my child's mental health if I don't know how I'm going to pay rent. And so really helping to figure out how to connect families with concrete supports and how to identify what families need and how they can get those things, and what are the barriers, right? I think COVID really illuminated barriers for families in ways that, because there was so much that was closed down, and those families that are really isolated were really isolated during COVID because there weren't those supports to reach out to them.
Rebecca, recognizing that there's no single solution for every family, many of the things that have been discussed are, again, quite systemic in nature: mental health, food insecurity, housing, which we haven't talked much about, transportation, which is very expensive in our region. Are there lessons from other states or even other countries that we can bring back to help just create a better beginning place for the families and children that we deal with?
Right. I think part of it is about governing philosophy. And I'm glad you mentioned housing because I was about to go there. Part of it is we need to understand, Tanya, you used the words they're worried about eating tonight. That is it. That's an indicator of acute stress. And there was a study just done in Rhode Island through Brown University that found that the levels of language development of infants and toddlers is lower than they've seen in 12 years since the study started. It's because of acute stress. When we tolerate systems that allow pervasive persistent, acute stress in significant numbers of our children, what we are saying is, as a society, we are tolerating active harm of children every day. We need to get to a place as a society where we believe that you have to support children before they're hurt so that they can grow up healthy and strong and contribute to our communities. So long as schools are the safety net of last resort, that's an indicator that we failed. So we have to get to a place where we question why it is we're only willing to help kids and not parents. And helping parents means making sure they can actually get access to housing, making sure they can afford to feed their kids and not worry about that next meal. It means if someone's sick or needs mental health, even though they got the policy, if there's a $900 deductible, acknowledging that that's too much. And that's where we are right now. So part of it is accepting that we are going to have to come to grips with the fact that just providing subsidies may not be the only solution, because just providing subsidies is a terrible way to create supply. I'll give you one example. When we were doing the childcare study up in Norwich, we found out through talking to providers that there were cases where individual parents had hired childcare teachers out of childcare centers and were able to pay them more to work as nannies. But every family that has the resources to hire a teacher as a nanny is a family who may not realize it, but they've taken care away from 15 other families who can't afford to do that. And we are at a place where the way we deliver services tends to privilege those who have the resources to provide for basic needs. As a community and as a state and as a nation, we'll have to get to a place where we understand that if we don't take the same sort of public health lens we're supposed to take to public health and apply it to making sure every kid and every family has a fair chance, we're going to have to understand that overtaxed systems where there simply isn't enough capacity to meet people's needs is our new norm. And that's something I hope doesn't become endemic.
And I'm going to push you a little on this. Are there best practices out there? Are there, are there states you say, I'd like to take this part of what Utah is doing, this part of what Norway is doing? Because it's, I teach public policy, and I always tell my students, when in doubt, steal someone else's good idea. You get to do that in the public sector.
Right. Well, I think yes, there are communities that do this more effectively at lower cost. We know in healthcare, for example, there are plenty of models in other parts of the world with single payer and national healthcare systems that deliver better results at a lower price tag. We know the same is true of education. The same is frankly true for early care and learning. The problem is cultural. If you believe in market delivery of essential government services and refuse to regulate, we are constantly going to be in a situation where a significant portion of our community doesn't have access to basic services because they just can't get them. And that's a cultural commitment where we have to decide as communities that we want to invest in basic safety nets that make sure every family is safe. My own grandmother, I've told this story a million times, was a foster child. I'm here today because she was able to be cared for when she had no parents and an abusive father who she was taken away from. How do we make sure that when terrible things happen to people, they're not left to their own devices? Because all of us know people who've been put in terrible situations. And the way to get them back on their feet so that they can hold down a job, buy a house, and take care of their kids is to give that hand when they need it. And that's a cultural commitment that as a community we have to have, because politics and the policy follow the cultural commitment. When we are stingy and focused on cutting state budgets, what we tend to do is cut these essential services. We don't provide public access to critical services. And instead we just leave it to families to try to fight to find access where they can.
Amber, Rebecca used the phrase new normal. I'm sure it's going to be a cliche soon, but in your world, what is the new normal going to look like even as we emerge from COVID?
Right. And I was going to chime in because I think Rebecca was making a really great point that a lot of these challenges, as we've been saying, were here before COVID, but the new normal is that there are more families experiencing them. It's been an amplification of what was already sort of there. And I think that that gap has grown. So families who are really struggling and families who aren't struggling so much, that gap is getting wider. And so, the new normal for us is having to support many more families. I think, I can highlight our caseload numbers. I joined the family place a little over a year ago, and I'm told that my predecessor had about 10 to 12 cases. I now have somewhere around 26 cases. that I am trying to work with. So there's been a massive increase in referrals, and I'm the physical therapist. So the speech and language and the challenges around social interaction and social emotional development are even greater. So we are needing to provide more support to more families who are facing bigger challenges. And I think one of the things that we need to make sure we do is not lose sight of that really important piece about empowering families. So, I know telehealth has its pluses and minuses, but one of the really big ways that we've been able to reach some families is over telehealth. So to start with, because we had to, but then because it actually gave us a way to meet families where they were at, families who, because of work schedules or recently mud season, meant that we couldn't actually physically get to them. So we can still have those sessions. And even more importantly, I can't go in with my bag of toys in my hands and just do. I've had to really hone my skills. And we've talked a lot about this on our team, about coaching families, helping them to identify what is it they actually need, and then how do we help them to do that. If I can't go in and just do it for them, I'm actually empowering them. And so telehealth is something that we need to use wisely, but I don't think it should go away. And I think it is a tool in the toolbox now to really support families and help them identify what they need to help. It's not about me telling them what I think they need. It's about them identifying, this is where I am at. And then we come in and help connect them with those resources and those supports.
Rick, I'm sure if we showed up at Dothan Brook, the playground would look familiar, even if I suspect dodgeball is gone. But okay, well, we won't talk about it. What's going to look different? What's the new normal running an elementary school?
It's a great question. So I'd like to just talk about the staff for a little bit, right? School looks very different now, right? Supporting kids' mental well-being is a regular part of schooling. Social emotional learning is a huge part of what we do. I remember when I first started at Dothan Brook 11 years ago now, we were trying to talk about instituting a social emotional learning program. And one of my great older teachers was there just before retirement. She's like, Rick, I don't like having to teach this stuff, but it's time. The kids need it. I'll do it. And, really grumpy, but she got it. And it has changed. Schools have to do so much more. The days of us teaching reading, writing, and arithmetic, that's over. Teacher prep programs, they have to change. The other thing that needs to change is we need to recognize that teacher stress levels are a lot higher, right? Pre-COVID, there was a study that found that school teachers are experiencing the same stress level as ER nurses, right? COVID has increased that. Right? When I talk to other principals, it's challenging to build in structures for how we support our staff, especially at the elementary school level, because they're with kids all day. Right? The way we fund schools are for teachers to be there with kids with a 40-minute prep, and that's it. We need to rethink that. Teachers need to start having supervision, much like the way that mental health professionals do, so that they can engage in self-care. Because if we don't start doing that, we're going to have a serious workforce issue. I think we're seeing that this year with the turnover in some of our schools, and that's not going to change. The kids' needs are here for a while, so we have to start thinking about how we rethink the school day, how we support our teachers' well-being as well as our schools, because when you're dealing with the emotional challenges that the kids bring in, they need an outlet. Staff needs an outlet for that.
It's interesting, at the beginning of the pandemic, there was so much talk about essential workers because those are the people who were actually showing up. None of that has changed, of course, and it's not clear that we've addressed any of those challenges, but that term essential workers, I hope will stay with us and that it will actually motivate some action. I want to remind everybody that the Q&A section is open and you can type in your questions there and then we will consolidate them and ask them to the panelists. You can address them to a specific panelist or to anybody, but just enter them and then we'll get to them near the end of our session. Tanya, what does the new normal look like for you, including some silver linings, some things that might actually be positive going forward that we've learned?
Yeah, well, I think one of the things that COVID did, I think, was to highlight how important mental health is. I don't think it's a stretch to say that COVID was not friendly to anyone's mental health. And, you know, some people weathered it better than others, but I think it really highlighted why it is important to kind of take care of that. And I think there's much more emphasis on it. And I think there are people who never thought that they would seek mental health supports that did because of COVID. And hopefully they won't have to wait for that to happen again if things happen. I do think we're seeing many more kids much more stressed. I think social emotional development in kids, I think, certainly took a big downturn during COVID. You know, for kids starting in about preschool all the way up to adolescence, peer interactions are so critical to social emotional development. It's a huge part of how that happens. And so we took all of that away during COVID, right? And replaced it with electronics, right? So kids were in front of the TV or in front of the gaming system, and they're coming out. And I'm sure Rick has many stories of just not knowing how to interact with other people. And not knowing kind of, you know, I think about, for example, if you took a kiddo who was in kindergarten in March of 2020, and then did remote schooling for, you know, the next school year, when they came back in the fall of 2021, they were a second grader. And there was a huge difference in social emotional development and what we expect of kids in kindergarten versus what we expect of them in second grade. But this poor kid didn't have any of the experiences to help kind of mold that. And so we've got kids who I think are really struggling with how do they interact with people and how do they interact with the social world. And I think hopefully as things begin to open up more, we can provide some opportunities and some of those rec programs Rick mentioned that I think are really critical to kids. And, you know, summer camps hopefully will be much more open this summer, so that kids can really have those experiences with each other. Because I think really getting kids back to interacting in just normal kid ways, because, you know, Rick mentioned pods in recess. I think even kids who went back to school in 2020 in that fall, all of the normal social things looked really different, right? Recess looked different. My kids are older, so they don't have recess, but they didn't play team sports in their gym class. They did individual stuff. Lunches for my kids' school, when they went back in person, they were scattered through classrooms. They weren't all in the lunchroom. They had to sit apart, you know, so all of that stuff that was kind of normal, the ways kids socialize at school didn't happen even when they went back in some cases. So I think figuring out how do we get kids back to some of that normal interaction is part of what will happen. Because I think if we get kids back together, they're going to catch up on some of those social skills.
So I should point out, sitting here on a college campus, that everything you just said also applies to college sophomores. So there's a whole cohort. And a number of people have mentioned we need sophomore orientation, because here's a group who kind of started college in a very unnatural space. Absolutely. And, you know, the first year of college is a lot like a playground. It's a very complex social ecosystem, and kids came in, you know, again, they may not be playing dodgeball, but it's a hard social milieu to navigate, and kids came out with other skills. Rick, did you want to add something?
So I just quickly, Tanya, what you said about, you know, cyber communication between kids and at least unkind behavior, if not bullying behavior showing up there, I think is all true. I think one of the other side effects that we've seen that's going to have a lasting impact is kids' access to explicit material online. And, you know, kids just spent a lot more time on computers over this time. You know, they just had a lot more access. And through that, you know, we've seen kids who were on pornographic sites, who were on intensely violent sites. And, you know, they carry that baggage with them into their relationships, into their conversation with peers. And, you know, they don't know what to do with that. And I think that's going to be a legacy that we're going to have to address and think about going forward is, you know, how do we support this cohort who has such an altered sense of self and sense of the outside world because of that?
Yeah, I think one of the big takeaways that we're hearing from everybody is the social media challenge is entirely separable from COVID, but COVID has exposed some of the things that have to be addressed. And since I teach public policy, in some ways, social media is kind of like, you remember they used to, in the old days, they would use x-rays to measure your feet. I'm not this old, but I've read about it, for shoes, right? Because it was kind of fun. You could see the bones and nobody had any sense of the radiation involved. It was a terrible thing to be doing. And in some ways, social media came along. It was all good and exciting. And now we're seeing the radiation. And it was completely undealt with before COVID. And that generation has doubly had to deal with that kind of stuff. So let's focus on the people who are with us today. There are lots of folks in the audience who do lots of different things. So if each of you could talk about some specific things that listeners today could do to empower, strengthen, make more secure families, what would they be? And let's start with Amber.
Yeah, absolutely. So, I mean, I think we've heard a lot about that lack of that sort of natural supports and being out in the community and rec programs. So you don't have to be a professional or even working in the field to give your time or your energy or your resources, use your expertise to give back to the community in some way. So can you read a book at a library or a local play group? Can you be the coach of the rec team so that they can have more children be a part of those programs? Can you donate hot dogs and buns to a community event that allows more people, more children and families to access those events? You don't have to necessarily be giving lots of money or even knowing exactly which program. You just need to be aware, I think, of what's going on out there in the community and support that. And I think giving your time is as important as anything, and also sharing these stories. So hopefully everyone here today is here because they do care. They want to know what's going on in this world and in their communities. So share these stories, share what you've heard today, share your experiences with other people so that the more people who hear about what's going on, what are the challenges being faced, the more people who can say, okay, what can we do about it? And that then feeds through to advocacy, policy. You know, if more people are talking about it, then our legislators may start to pay more attention and say, okay, what are the policies that are needed? How do we make this work? So I think it really starts at that ground level of what can you do really locally in your community to support what's already there, but that needs to be reinvigorated now that we're coming out, hopefully, of this COVID situation.
Rick, some specific things that people who are listening can do.
Yeah, I think giving each other a little bit of grace right now, right? You know, that we're all coming out of this situation. You know, I've heard many people refer to COVID as a collective trauma. Everybody's dealing with that in different ways. It's impacted us and it's impacted our kids in different ways. So just having an understanding that schools are going to be a little bit slower right now to build those relationships with kids, to help kids, to hopefully help families heal after this. And it may look a little bit different for a little while. It may never look the same again, and that will be all right. But understanding that change is happening, that it's necessary, that if we are taking care of each other first, that we're all going to come out of this in a better place.
I like that, because grace is not something we've been terribly generous with as a society lately. I think it's a good idea, regardless of COVID. Tanya, specific recommendations for people watching?
Well, I want to pick up a little bit on what Rick said, because I think from my lens with the mental health world, I think, you know, when kids struggle with mental health issues, it shows up behaviorally. Right? That's the way that kids tell us something is wrong with their world, is that there are behaviors that are not pleasant. And I think that, unfortunately, one of the things that happens when kids are struggling emotionally and behaviorally is we instantly point fingers at parents, right? So if that kid is throwing something across the classroom and is totally out of control, it must be because parents aren't doing their job. And that is so incredibly unfair. Because I can tell you from 20 years in mental health that parents who have children who struggle with emotional and mental health issues are beyond stressed. And they have, in most cases, done everything they can think of and are doing everything they can think of and are at their wits' end on a daily basis. And to have, you know, whether it's the teacher or the, you know, person at the rec center or the person in the grocery store parking lot kind of point a finger at them and say, you must not be doing your job, just doesn't help. And so I think that when we see kids who are having a really hard time, that one of the things we can do, all of us, is to kind of step back and wonder kind of what's going on with that kid, what's wrong, what supports does that kid and that family need to really be better and to be in a good place. Because kids, it does not feel good to be out of control to anyone. Kids don't misbehave because they want to misbehave. If kids can do well, they will do well. And so it's about finding out what supports can we offer to kids and families. And I think some of Amber's suggestions about how do you get involved in your local community? How do you help some families in your community? How do you help your neighbor? How do you check in? I also think the other piece that I think we need to be really aware of is how much COVID has impacted in terms of mental health, and really taking the chance to ask kids and doing some mental health screenings in pediatricians' offices, even when we think a kid isn't struggling, because I think sometimes they don't always show us. And I just a quick story, I had my son, I knew was a little bit anxious with COVID. I didn't realize how much until I got the second dose of my vaccine, and we were driving home and he said, "So this means you won't die, right?" And so to me, that was just this huge window into how much anxiety he had been carrying that I wasn't really tuned into, because he hadn't said that. He hadn't asked that question. He hadn't mentioned worry about people dying, but clearly that was on his mind. And so I think that our kids, because they pick up all sorts of things around them, and they've heard all sorts of things over the last couple of years, carry a lot of stuff. And we need to be checking in with them and asking them, and not just assuming that they're okay.
I'm going to interject because I know Rebecca and I are the policy people and use my prerogative. And I'm going to come back to housing and say, don't be part of the problem. Housing is constrained in most communities by zoning, and a lot of very well-meaning people stand in the way of building a wider range of housing, not just subsidized housing, but housing that is affordable to a broader range of people. And if you want a fairer society, you've got to have a more socially inclusive community, and that begins with a wider range of housing. So there are 100 reasons you can say we shouldn't build that apartment complex, but most of them really collapse when you push on the things that will get us to the kind of society that most people want. Rebecca, what can people do?
Well, I'm just going to put in a plug for housing too, because housing is a hidden driver of so much of the challenge that people have talked about this. And even in my own community, I would argue that inclusive zoning practices, acknowledged or unacknowledged, have made it difficult for families to be able to afford to be there. And that has other impacts, not just in my own community, but in all the neighboring communities as well. And we have to decide, if the freedom and unity in our state motto means we're all in this together or not. And our policy right now says we're not. And as long as that is the case, we will not be able to address these problems. I believe in volunteerism, but I'm highly skeptical of 1,000 points of light, because I think we've seen in the pandemic how voluntary support for neighbors it's not a safety net. There are just too many people who fall through. And I'm very, very worried about that. For me, there's three big issues. One is we have to flip this discussion of affordability that we're having on our head. Remediation is much more expensive than educating kids right the first time. If you don't want to service the warranty, just do the job right. That means make sure they have the access, the safety, and the support they need to actually not need all these services and supports, because they're already taken care of. As a state, we rely on remediation because we're too stingy at the front end to build the product right. We have to flip that narrative. The other is we have to lean into our assets as communities. We have to lean into what you've described about rebuilding relationships, about teaching children how to be part of a community, because that's our first job, but also, frankly, it's foundational to democracy. It's how we learn how to live together, share a space, share a community, and take care of each other. That is perhaps our most important task, not just at the community level, but at the national level. But it starts right here at home in schools like Rick's. And if you want to know if this can be done, I really wish you'd had a chance to walk into Rick's school 10 years ago and walk into it today. It's a testament to how well the hard, consistent, long-term sustained attention to helping people be good people how it pays off over the long haul. And with that, we also need to think about, when we talk about community, we also need to talk about community institutions and government. I actually believe we have an anti-government ethos in Vermont, which is actually keeping us from using one of the most powerful tools we have to make sure that there is a safety net other people. I often heard people talk about public schools as government schools, using that as a derogatory word. But here we've just seen testimony to Rick's school and how it opens its doors to every child and provides them a darn good education at a price the community supports, but also meets all those extra needs that have been pushed back on that school. That's incredibly powerful. That's why I'm here today. I suspect it's why many of the people listening in our audience are here today, because when they needed that support, when they needed that education, there was a government institution there ready to make sure that they had it. And I hope we can use that tool judiciously to push the issue on housing, to make sure that families, right now we talk about affordability, the gap between minimum wage and livable wage in the Upper Valley is about $10. So affordability is not an issue for many, many of our families. Those are solutions that will need government intervention. And that is something that the listeners today can make sure to hold our elected leaders accountable for.
Yeah, I'll put a finer point on that. I think one of the challenges is that people take government for granted because the things that work attract no notice. So for example, I spend a lot of time in the tech sector, and the tech sector has a libertarian bent, with the government just get out of the way, of course, but the whole sector is built on copyright law that everyone just takes for granted. And I think you can go through a number of those kinds of areas where we need to remind people where, how, and why government is supporting other things that they do. Even people who are relatively market friendly depend on a lot of these things.
If it makes you laugh, Charlie, I had a conversation. I was sitting between two people, one who said we ought to just do vouchers and get rid of any schools or any child cares, and another who said without government we can't solve the climate challenge. And that's the problem. I mean, we're not using this tool judiciously where it can make a real difference.
So we're going to pivot to questions here, and I'm going to give Nancy, as director of the Family Place, a prerogative here. What would you say to parents of young children who are watching this conversation? I'll offer that up to anybody who's willing to take it.
I'm happy to start off because this is kind of what I do every day. I'm talking to families. And I think the first thing is a recognition that you are doing the best you can. And that's a really great job. And I think sometimes parents just need to hear that there are a lot of challenges. We've talked for, nearly an hour now about some of the challenges and the stresses and the strains. So sometimes you just need to hear, you're doing a great job and here's how I can help. The other thing I would say is don't be afraid to reach out. It can be scary to go to that play group or to join that organization or have a cup of coffee with someone you don't know, but that might be the door that opens the next thing that's really helpful for you. So try and get out there. And if you're not sure how to do that, there are a lot of supports available, whether it's through early intervention services, mental health services, or even just community organizations, your local library. Get out there and try and make those connections again. And if you're someone who's really good at that, bring someone along with you. Let's open our eyes, look around and help each other out in this process. But know that if today isn't the day you can do that, maybe tomorrow is. And today you're doing what you can do, and that's okay.
This question's from Sarah Kobolensky, who's a great friend of many organizations. It seems like every event I'm involved in, Sarah pops up. And it's such a wonderful question, which is, a student suggested to her that Maslow's hierarchy of needs should be reworked to put belongingness at the bottom, which is the base, the most important. And I will add that so much social science research highlights the importance of social connections, friendships, in determining longevity, mental health, and everything else. So the question is, what can we do to promote belonging and connectedness? Because I, like Sarah, do believe that it is so important for everything else. And again, I'll offer, I don't have any great ideas, but I would just underscore the importance of the idea.
It is such an important idea. And I think it is, I think it's one of the reasons that you saw so many mental health challenges during COVID. Our brains are made to connect with other people. And in fact, we know now that, infants and toddlers, brain development happens in connection and in a relationship. And so I think, what can we do to promote it? That's a hard one, because I think we have such an individualistic society and we all kind of go our own ways. But I think, joining a play group, making a connection with your neighbor, taking your kids to the park and actually talking to the other moms instead of, or other dads instead of being on your cell phone, putting cell phones down and turning off some electronics and actually interacting in person. I think it is a hard one, I think, because, and particularly in the Upper Valley where things are so spread out. But I would agree, it is so critical.
And I would say it's critical for adults as well as for just, you know, the
Absolutely.
connection between social connections and all other things that we care about, particularly social determinants of health, are so fundamental. Any other suggestions for kind of taking this lesson from COVID, which existed before COVID, but was highlighted?
I'll just take a swing because I think this goes back to some of the points others have made so much. And, you know, years ago, one of my children was on a medication that made them completely nuts. The behaviorally, they were the acting out behavior kid, and it was medical. And it was a brief experience that was powerful for me to do as an educator, because I got to experience for a very short period of time how isolating it is when your child is really struggling. And that could happen to anybody, and it happens for reasons that parents don't control. And again, if we want to build relationships, we need to build relationships with parents, including parents of children who are struggling. Because when we cut them out of our communities, when our institutions aren't inclusive and don't welcome them all, no matter who they are, we are sending a very, very powerful message to them about their worth that is going to trickle down to how their child perceives their own worth. And so for me, it is making sure that to the extent that we support community institutions at all with any public investment, they have to be open. They have to be open enrollment and embracing and inclusive of every one of our community's children. These are all our children. We should not let institutions that are supported with state tax dollars exclude kids. Bottom line. And unfortunately, we do that too much. And that's a problem. And that's something we could address with legislative changes that allowed communities to contract for services or to manage childcare in a way that we didn't have childcares that were entirely kids who've been rejected by every other childcare in the community. Taking care of all of us should be all of our responsibility. And in fact, the inclusive communities are the ones where we can build those relationships and those pro-social behaviors, because people can lean on each other in ways that help them get healthy and whole. And so for me, as my strongest recommendation on that front would be to just, in every policy decision, in every investment, ask, is this an inclusive investment that will support relationships? Because if it isn't, then we need to look for another option.
You've actually reminded me of a book recommendation. There's a book called Our Kids by Robert Putnam that makes this point using a lot of social science research that the society is being cleaved in many ways. This is all pre-COVID. And the title, of course, Our Kids, suggested it is our responsibility. And he does talk about housing and other kinds of things that have contributed to this. So for people who care about this stuff, I think they would find it very, very interesting. There's a follow-up here, and maybe we're going back to Rebecca, but some others can jump in as well, which is, okay, what should we do about this shortage of mental health professionals at every level? Because if we feel it at the college level, and you've spoken about it as well, how can we get rid of this shortage when people really have profound needs?
I mean, I don't want to over talk, but so I'm going to let.
If you've got an answer, I think any of you would be willing to listen.
Well, I think there are a couple ways to do it. I mean, one of the challenges, and this is something that could harm the designated agencies even more, is that their incapacity currently to adequately compensate mental health professionals is a huge piece of why we don't have enough. I mean, this is a market delivered service that is undervalued. We don't pay these people enough for the incredibly valuable work they do. One of the reasons there's such a shortage in the broader population is school districts pay better, for example. And what we're starting to see across the state of Vermont is that school districts are hiring these folk into schools where they then are unavailable to provide those two-generation services. So figuring out as a state how to incorporate, to change the way we approve and regulate health plans, for example, to ensure that mental health services are incorporated wholly into healthcare, but also that there is adequate capacity to pay or reimburse sufficiently to actually hire and retain quality staff. There are other things that the state can do, and it's a different issue depending if you're in a rural community or in a more densely populated community, but there are huge problems, particularly in our rural communities, not just with mental health professionals, but actually with primary care doctors. And the state has and the federal government as well, have figured out ways to support loan forgiveness, to support professional career pathways that support, provide low-cost access to the education people need to get credentialed to work in those fields. So there are options like that we could pursue as the state as well. But we need to see mental health as part of healthcare and make sure we treat it in the same way. And then where it is not present, because we have a market delivered healthcare model, it's not cost effective to push it into rural communities in particular. That's where government needs to step in and make sure that we've appropriately incentivized it to make sure people have compensation and incentive to work in those communities as well.
Rick, you spoke about the mental health challenges at the school level. So what specifically would help you in your building with regard to the mental health challenges that you face?
Yeah, so we know a couple things, right? Yes, I did unmute. Sorry, I didn't think I unmuted for a second. We haven't had that happen where somebody has been talking, not muted yet. So that seems like it has to happen in a
We've
Zoom.
come a long way in 2 years that we've been using Zoom.
We have. So when we think about opportunities that create best outcomes for kids, we want school, family, and medical, including mental health, to be working in concert. When things have gone well, that's what happens. So we need to be able to break down those silos so that everybody can have an exchange of ideas, so that we can be getting together on a regular basis to talk about the kids that we're collectively serving, right? I should be able to, with family permission, obviously, be able to talk to a therapist, a child's therapist, and they should be able to get billed for that. We should be able to have the same thing. Pediatricians should be able to come to the schools to observe the kids and meet with their teams. That doesn't happen now because it's not a billable service. It's lost revenue. In the places there are therapists, there are pediatricians who have done this on their own, and it's a beautiful thing. You know, I see Dr. Williamson on this call. He was one of them, you know, who came to our schools and had a partnership with us, with the family, and it is so powerful. So we have to break down those walls. It has to be there. And that comes through insurance reform. It comes through probably other things that I don't know as a school educator. The other piece is that we need to be getting services to kids earlier on. They shouldn't have to go into crisis to be able to access mental health services. If we're able to work in a tight partnership with our local mental health people, we can be training staff to be building therapeutic supports into our universal programming that's available to all kids to help them write off. We should be able to help kids who have red flags, short-term interventions. We know that 6-week interventions can be really powerful for kids if they're caught early on. And we need to be able to do that for kids when they come through screenings from whatever ways, when parents have concerns, without having to get them enrolled in any other way. We should just be able to do that. But you know, that requires us to be able to break down those walls between those important fields. So that would be my recommendation.
We have a question here that's a perfect one to end on for each of you, which is basically what keeps each of you doing what you're doing? Because we've talked about, you're all climbing pretty steep hills, and that hill got a lot steeper during COVID. So we'll go around the horn, but I will start. I mean, the reason I do public policy is because I'm inspired by people like you, and whether it's political reform or healthcare reform, there's so many thoughtful, altruistic people who migrate into these fields that I'm inspired by the work that they're doing, and particularly this group. So I'll go around my screen. Amber, it's exhausting. What gets you up and out of bed every day?
Well, I mean, I have been a physical therapist for probably 12 years, and I've always worked with children, and people always ask me why. I say, because for every challenge and every difficulty that comes with working with children and families, the triumphs are really big, right? So for me, when I've been working for a really long time and that child walks for the first time, or that family feels like they can go out and go to a community event, that is worth all the struggle and difficulty to get there. So those triumphs are so big that it keeps me coming back. And that feeling, of course, that I can do something good, not just for individual families, but by being involved in these types of conversations and advocating for the work that I do, I can affect a bigger system and help more people, more families. And that will keep me going for a very, very long time.
Rebecca, your work is very different because you're in politics, and I know what that feels like. So,
Oh,
what
Charlie,
keeps you going?
I'm trying so hard to get out of politics. Look, I mentioned my own family earlier. My grandmother gave up her son because parental rights to her son because she couldn't afford to raise 2 kids. I know that people find themselves in unimaginable circumstances through no fault of their own. And I also know that when people feel safe, that they're able to bring back and enrich and make our community strong and healthy. And that's what keeps me motivated. What keeps me motivated is people like Tanya, like Amber, like Rick, who are in there doing this work every day. And what I want to do, and I hope everybody listening today does, is figure out how you can get behind them and push, because their work is valuable. It's what lets us have a future. And to the extent that we can find ways to help them out, whether it's through policy, speaking to our representatives, and supporting investments in early care and learning, in the well-being of our children, that's what we can do to make sure that everybody who lives around us has that same opportunity.
Rick, I'm married to an elementary school principal, so I know a little bit about what your answer is going to look like. There is something wonderful about a building full of children, but if you could talk, but it's also, it's a building full of children. So, what keeps you doing what you're doing?
Yeah, so I love thinking about larger systems and how all the puzzle pieces fit together. That was what was the draw to school administration. And I like to think about the power in schools to make long-term change. So it energizes me to think about how we are addressing the problems that we're addressing today, may have some gem, some part that can be carried forward, made larger to support many kids, to help improve outcomes for kind of larger bodies of students and kids, to help everybody have a chance, everybody to have an opportunity to succeed.
I think it's a really important point to focus on systems, because we have a proclivity to focus on pieces of things, and the way they fit together is quite extraordinary. The connection between housing and health, between mental health and physical health, and so on. It's a really wonderful point. Tanya?
Yeah, I think it is really an honor to be able to kind of walk with people through really, really hard times, and to watch kind of the strength and resilience of both kids and families when they come out on the other side. And I think it's hard work, and sometimes it's heartbreaking, but it can also be very, very rewarding. I also think the other thing that keeps me doing this is because I'm doing it at the family place. And I think very much we take that whole family approach, which is very nice. And I think we also take that bigger systems approach. So I have never been told I can't go to a school meeting because I can't bill for it. I worked in a mental health center. I was told I couldn't go to school meetings because I couldn't bill for them. And as Rick said, it is so incredibly important to have everybody working together. So I think being able to do this work in an agency that really understands and supports the value of teamwork, the value of community, and really does that not just through lip service, but really does it through our policies and our practices, is a big piece of what keeps me.
Well, that is a great finish to bring Nancy back, because it's what the family place does. Teamwork, focusing on long-term solutions, supporting families, seeing the whole landscape. So Nancy, you're going to close us out, but thank you for your work as well.
Thank you. Just going to wait till Kathy joins us too for just a few closing remarks. So huge thank you to all of you guys. This has been such a rich and meaningful conversation. I've taken so many notes, and I'm walking away with so many pieces of this conversation that I'm really excited to continue with you all. So along with Kathy Clement, our board chair, I just want to say thank you to you, Charlie, for leading this discussion, asking such great questions, and making the most of the short time we had with this remarkable panel. Tanya, Rick, Amber, and Rebecca, we are truly grateful to each of you for joining us and sharing what you are seeing through your work every day, and also challenging us to think and work differently as we envision the path forward. Most especially, I just want to echo Charlie in saying thank you for everything you bring to the critically important work you are doing every single day. We have quite a few early educators, human services, mental health, and healthcare professionals in our audience today, both family place staff and community partners from across this bi-state community. I want to take a moment to honor each of you and everything you do to support our children, their families, and a more responsive community for all. Experiencing such intense need at a time when the workforce is lean really compels us to work even smarter together and to support one another as much as possible. I think we do that well in this community, and I thank you all for your expertise, your dedication, and your partnership. I'd also like to acknowledge all the parents of young children in the audience today and on our panel. If you've been involved with one of our programs, I want to thank you for placing your confidence in us. We encourage all families with little ones to reach out to learn more about the supports and opportunities available to you through the family place and in this community, and to let us know what would be most helpful. Also in the audience are loyal friends, neighbors, community members, donors, people who have supported the family place and fostered our work with children and families for many years and through these especially challenging last few pandemic years. I really want to thank you right now for your commitment and your partnership. Included in that is our dedicated board of directors, who I want to recognize and thank for your ongoing commitment. These volunteers and community leaders work with me to set strategic direction and ensure that the family place has the capacity to evolve in response to emerging needs. If you are interested in learning more about board membership, we would love to hear from you. And a big special thank you to the staff and board committee who worked so hard to make this event happen, as well as everyone who planned and sponsored our Month of the Young Child events earlier this month. These events included the Shield Our Children from Harm Conference, which is offered every year in partnership with Dartmouth Health and the CAC there, and our Week of the Young Child family activities, which had wonderful community support this year. We are so grateful to everyone who made these events possible, including today, our staff, partners, the engaged community who is participating, our generous event sponsors, including our supporting sponsor, the Aloha Foundation, and all who donate to our organization. Thank you all. And finally, I'd like to thank each one of you for spending your lunch hour with us, for asking questions today. I can't see your faces, but I know that we share a commitment to ensuring that all young children and their families have the best possible start in life that our community can offer. I look forward to staying connected with you in the weeks and months ahead, hopefully seeing you in person. We will share responses to any questions that you may have asked today that we didn't have a chance to answer in our follow-up newsletter and also on our website. And we will be sharing a link to the recording of this webinar if you'd like to watch it again or share it with someone else. If today's conversation inspired you, here are some ways you can help further this work. First, as Amber said so well, please continue to talk about this with your family, friends, and colleagues. COVID illuminated and amplified systemic challenges and inequities that can only be addressed if they are named and understood widely. Second, lend your support and your voice. As our panelists said, get involved, stay involved with the family place and other organizations that focus on children and families. Encourage your neighbors and your local and statewide officials and representatives to support meaningful investments like you've heard about today that address poverty, promote equity and health, and expand opportunity. And finally, we hope you will help us shape the direction of the family places work going forward by lending your perspective to our strategic planning process. This summer and fall, we are going to be reaching out to gather your feedback and ideas as we consider how best to focus our resources over the next 3 years. We especially want to include perspectives of a diverse group of parents, foster parents, grandparents, and other caregivers. So I hope you'll watch for opportunities to share your thoughts with us. So once again, thank you all on the panel. Thanks to all of you for being with us today. So glad you could join us, and I hope to see you soon.